This is the injury report. I'm Dr. Stephen Michelsen, orthopedic surgeon with Forest Park Medical Centers. Turf toe, an injury that affects several athletes and can put them on the sidelines for weeks or even months. Essentially, what is turf toe? It's basically a sprain to the great toe involving the ligaments and supporting structures on the bottom of the great toe. The term turf toe came about with the introduction of artificial playing surfaces. The joint involved is called the metatarsal phalangeal joint. Essentially, the long bone of the foot called the metatarsal and the phalanx or the great toe. The first joint is the main joint. It's surrounded by important supporting ligamentous structures as well as tendons and soft tissues and joint capsule. Essentially, injury to this involves varying degrees of stretching, partial tearing, or even complete disruption and dislocation of the joint. Treatment of all the injuries, grade 1, 2, and 3, involve the RICE protocol. This includes rest, icing, compression, and elevation. Also included is some anti-inflammatories, and additionally some supportive devices which may include a hard-soled shoe or a boot. Grade 1 injuries typically resolve within a week or 2 weeks. These are treated with the RICE protocol as well as supportive taping and an insert in the shoe called a Morton's extension. A grade 2 injury is a slightly more severe injury involving partial tearing of the plantar complex. Initial treatment with the RICE protocol, in addition to anti-inflammatories, as well as taping, sometimes a hard-soled shoe or a boot for a short period of time. Range of motion is initiated as soon as the swelling decreases and the patient is able to tolerate. Progression into a regular shoe with an insert called the Morton's extension to provide increased stability and support to the great toe. Grade 3 injuries or much more severe injuries can be associated with dislocation as well as bony injury or cartilage damage. These sometimes are assessed more with an MRI to assess the need for surgical intervention. Patients are initially treated with the RICE protocol, as well as taping, sometimes casting, hard-soled shoe or a boot. As symptoms resolve, the patient is progressed to a firm-soled shoe with an extension, continued physical therapy. Progression to activities could involve 6 to 8 weeks or even longer. Surgical treatment involves reconstruction of the plantar plate, reestablishment of stability of the joint, occasionally fusion and correction of deformity. Although a turf toe injury may seem like a minor injury, it can sideline an athlete for several months, the entire season, or even potentially in their career. This has been the Injury Report with Dr. Stephen Michelsen for Forest Park Medical Centers.